So much, Alex. And joining us once again this morning, Dr. Kothary, the Chief Medical Officer for Dignity Health in the Central California Division. Dr. Kothary, good morning to you. How are you doing, sir?
I'm doing pretty well, Maddie. Thank you.
All right, let's go ahead and go back to that graph real fast that Alex was narrating for us and kind of explaining. This is our curve, and I think if we can go back to the one of the new cases, that very first one we were showing, and talk a little bit about the new cases that we're seeing. Now, it does look different because Public Health changed yesterday how they're going to report those. When they report these cases, they're going to put them on the day that the people took the test instead of on the day that those test results come back. So if we look at this graph right now, it looks like we're on a downward trend. But Alex was kind of explaining that area in red, so these last few days where we've seen that downward trend, those will have more cases added to them as those test results come in. So what do you think of the trend that we're seeing right now? We had 12 new cases added yesterday morning. We did not get the 4 p.m. update, which we had been getting. So are we on a downward trend? Do you think that we're kind of getting a false sense of security right now because of the way that the numbers are laid out?
You know, I think what we're going to have to do is we're going to have to wait a few more days. And as these test results, we'll be able to tell, you know, a true trend. I am very cautiously optimistic right now, but I don't want to give anyone a false sense of security where they can just go out and start mingling together. So I think the next few days are going to be very telling for us.
Okay. Let's talk about the plasma treatment, because yesterday we had the very first local survivor of COVID-19 to donate their plasma at Houchin Blood Bank. And we talked about this yesterday at the end of our interview and how this is going to go on to be used. Can you tell us a little bit about that process and how that's going to happen?
Absolutely. So I've actually applied for a research grant to be able to do this. And it's just a form that we filled out, and I'm going to be the principal investigator. And what happens is, once we have a patient that we've identified that's critically ill, that we just don't have anything else for, that's when we give the plasma to. What the plasma seems to do, or what it's supposed to do, is it's got antibodies from someone that's recovered from COVID. You give this really sick person that plasma, hopefully the antibodies that the person that recovered has made will help fight the COVID in the really sick person. That's the logic behind it. We've seen a small study, seen it work really well, so we're hoping that we can use it here in Kern County and help some people as well.
Do you have patients that you want to use this on right now?
We have identified some patients, yes, in all of our hospitals in Kern County, yes.
Okay, so let's talk about those who are in the hospital right now, because that's a new number that we learned from Public Health yesterday. They started giving us the current total of residents or people diagnosed with COVID-19 in Kern County hospitalized. They say that is 22 people right now who are in the hospital. What's the treatment course like for COVID-19 once you're admitted to the hospital?
So what happens is primarily when these patients get up in the hospital, we get an infectious disease person or a physician to come consult on them. This person will come in and consult on them and decide, can this person be on Plaquenil? Can they be on another drug? Do they not qualify for any of these experimental drugs? Do they need to try remdesivir? Or are they too sick for any of this and we just have to put them on plasma treatment? So we get guidance from this infectious disease doctor, and then that's where we take our guidance from.
At what point does a patient get put on a ventilator, and what's the prognosis like once that happens? So
what happens is, if these people, as their respiratory function worsens, as their breathing worsens, as their oxygen level worsens, and they're starting to struggle to breathe, a lot of times we'll put them on a ventilator. What the ventilator does really is gives the lungs some time off. We do the breathing for them, the lungs kind of relax and rest. And in the meantime, you know, we try and fight the virus off as well. Now, these patients on ventilators, you know, they can be on up to 3 months, up to three to 4 weeks, up to a month at a time. So it's a long-standing process.
And what happens, in what point does a patient get to come off of a ventilator, and then what is their prognosis like once that happens?
So usually what we do is we look at these patients daily, so most of the time twice a day. And we're evaluating their breathing status, we're evaluating their lung function. And if we think our intensive care doctors, if they think, this patient can come off, we actually do what we call an extubation. So we take them off the ventilator and see how they do. We just give them a trial. And if they succeed, we keep them off of it. If they don't, we can always re-intubate them.
What are the chances of recovering once someone has been put on a ventilator?
It's a hit and miss thing. We don't know. It just depends on all their other conditions. If you get a typically healthy person that goes on a ventilator, chances of them coming off pretty decent. If they have a lot of other comorbid conditions, it's hard to say. It's just, this disease is so different in anything that we've come across that it really is, we go in there daily to see how they're doing. We can't guess at all.
Do we know how many patients are on ventilators currently in Kern County?
I do not have that information at all, but I do know that we have taken some people off the ventilators and they are doing well.
Okay, I want to get to one viewer question because this is something that I've seen a lot of people asking on social media. New York Governor Andrew Cuomo said Wednesday that the state would begin reporting probable coronavirus deaths to the CDC based on new guidelines. And I've heard a lot of people on social media pretty upset about this and also confused about why it's happening that only probable cases are going to be added to that number without confirmation. Can you explain that and talk a little bit about why that's being done?
I'm not sure why that's being done. I myself would also like to know, actual deaths from coronavirus. I think probable, throws us off a lot because there's other conditions that can cause symptoms very similar to coronavirus and still cause mortality. So personally, I would like to see cases from coronaviruses that have caused that, not probable cases.
Is that happening here in Kern County?
No, it's not.
Okay, those cases, those 3 deaths that we have reported here in Kern County so far. All right, Dr. Kothary, we are out of time again, sir, but we appreciate you, and we know that you have very long, busy days. Dr. Kothary's been joining us Monday through Friday, so again, if you have questions for him, please send them to us, and we'll try to get to them during Sunrise. Dr. Kothary, thank you, sir.
Hey, thank you, Maddie.